management of tennis elbow, or that lateral arm pain that we talked about. So the tennis elbow and that lateral arm pain kind of starts right here up at the elbow, and oftentimes they experience a lot of the pain kind of right there where the tendons attach into the joint, but even going down throughout the back of the arm, the wrist, and the hand. So we can use the tape to help support those tissues or any soft tissue work that we did. So with this, because we've got a couple muscles that we're gonna try to support in terms of the extensor carpi radialis brevis and longus, extensor digitorum, all of these are kind of attaching right here at the elbow. We're going to use the tape to support a couple of these. So this is a pretty thick piece of tape. You can decide to use just the full piece of tape, or you can actually cut it and do a couple ribbons. So we'll actually do the ribbon technique here. So we're first going to take the piece of tape and we're going to cut it, so just round off the edges of it. And actually going to need to do that again. So we're going to fold it in half so we have it in the, we'll just cut it straight down the middle. Our nice grid lines there. You can finish rounding off the corners, finish rounding off the corners. And we got that on each of our strips there. Okay, from here, we can use little tabs just so that we're not touching the adhesive part near as much. So we can use the tabs to stretch. We want to make sure that the skin, the tissue is nice and clean, that there's no gels or creams or lotions or any emollient that we use in our soft tissue work, that's all been cleaned off to help with the tape actually stick, help with the adhesiveness. From here, we're going to start proximally, and we're going to place that first piece of tape kind of right here up at the top, and then using our indicators, our stretch indicators, we're going to stretch it to this time just 25%. So we're just kind of trying to get some healing properties with this. We're not trying to necessarily support the muscles, just trying to help with the healing. All right, if we get some muscle support, fantastic. So just that 25%. And we're coming down just laterally through there. So we see that the smaller hexagon is an equilateral hexagon. The larger ones are not quite. They've been stretched some, but not fully. So we know that we're not at 50% yet. We're also going to do even more laterally, kind of down the side of the arm even more. Cut that piece a little long. It's all right. Coming into the hand, we're just going to reinforce that. And then from there, we can even do one more piece, kind of coming a little bit more on the lateral aspect as opposed to the medial aspect. And rounding our edges again. We create our tabs, create our tabs. And this time we're going to come down the lateral aspect of the arm a little bit more. Giving it that 25% stretch. Come off. There we go. And she can definitely golf with that. Again, there are multiple techniques. So if you don't feel comfortable making the multiple strands, or you're pressed for time, just the one strip, the one solid strip can reinforce as well. If we really want even some more support, we can kind of mimic that tennis elbow strap that oftentimes we see, or that we recommend people to use. And we can mimic that. By coming across. And this time we're going to use more like a 50% stretch, just because we're actually trying to mimic that strap. It'll come right across those tissues there. And she can golf with this, she can shower with this, she can sweat with this. As long as it stays on, she can keep it on. We recommend for aftercare, if she showers or sweats, just kind of towel, just pat it dry, don't actually rub it. That helps to keep it nice and secure. If she would start to get irritated, or if it would start to bother her, she can obviously take it off. We want to make sure that she knows that. Don't want her to keep it on if it's irritating. But otherwise, I've had great success with this. People going down to Florida and golfing for multiple days in the hot, humid weather, sweating, showering, and they come back and it's still on, 4 days later. So great adhesiveness to it, and can be great for our people dealing with tennis elbow.